So let's get some analysis and reaction to this debate about AstraZeneca, the vaccine. I'm joined by the President of the Royal Australian College of General Practitioners, Dr. Karen Price. Dr. Price, thanks very much for your time. Can I start off just with your overall assessment of the efficacy and safety of that vaccine?
Well, we have two very safe vaccines that prevent severe hospitalisation, intensive care admissions and death. So they are stratified by the ATAGI group into age preferences, so that over 60s AstraZeneca, under 60s are ideally Pfizer. And so there is a provision in there for an informed decision, because it also depends upon what is happening in the community at the time. So if we have COVID zero, then it obviously favours that. If we have increasing COVID cases, then that risk-benefit, potentially changes. And then we have someone's individual choice about how they feel about managing risk. So it is a difficult thing to get your head around, but the risk of dying from AstraZeneca, I saw Nick Coatsworth quote the 1 in a million, which is correct, because we're getting much better at treating the TTS clot. So, and Pfizer also has side effects. There's a reported rare pericarditis, myocarditis. There is no medication that is free of side effects. Even a glass of water will have potentially side effects. So, we have to weigh this up as an individual. And, these statistics, never say stats on TV, these are population, population stats. And, people have to then individually apply them to their own circumstances. And that's where the risk is. And what's happened, it seems to me, is there's a whole lot of anxiety, and we just need to calm down. This hasn't changed. The advice hasn't changed. GPs are used to trying to interpret this for each person's individual circumstances, and people can be guided and feel comfortable with the ATAGI guidelines. We are safe in Australia if we follow the guidelines.
Do you think some of the language from, Queensland in particular has been unhelpful?
Look, what I see is a nation that is suffering, and that includes our political leaders of either side. I know the doctors are feeling it, and I know the community is feeling it. No one is enjoying the pandemic. So I think some of that conversation and the lashing out and so forth, I haven't seen it all. I'm not attributing that to anybody in particular, but, it comes from people who are frustrated and a bit overwhelmed and probably a little bit overworked at the moment. So I think if we just take it back to basics, the ATAGI advice still stands. That hasn't changed. What happened on Monday night was that the Prime Minister and the Cabinet had a discussion regarding indemnity insurance of all things for GPs administering the vaccines. That was a big announcement. Somehow that got lost when there was a question asked, and then it's become again a debate on principles of black and white, good versus evil, and that's not how medicines work. That's not how risk-benefit works. So we've just got to calm down and appraise the evidence, and if you're not sure about that, go and see your GP.
Do you feel that we will get this back on track, the rollout? Because at the moment, the hesitancy problem seems quite palpable in the community.
We've got a whole range of responses. So we've got lots of young people who really want to get this pandemic over with. Their lives have been, shut down for a long time in many ways. We've got businesses who are suffering and so forth. So there's a whole range of responses. So vaccine hesitancy is one, and confusion and needing more information is another. So there's a whole range of responses, and to get adequate information for your particular circumstances, I encourage you to speak to your GP about those particular circumstances. What we also have is right at this point, at the nexus right now, is we have the outbreak that we've currently got, which is pretty amazing across Australia, how quickly the variety has spread. And we've got just the beginning of the Pfizer rollout. So Pfizer is coming. We will get increasing doses by the end of July. We'll have 1,300 general practices delivering it, and that will increase every week through every month to the end of the year. Where we'll be pumping Pfizer throughout the nation. So, and AstraZeneca will tail off, not because it's a bad vaccine, but because we hope that we have vaccinated most of our older and older population over 60.
Yeah.
We do need those people to come forward and get it done. It's not. It will still be available should you want it, or if you're in that category. And there may be people who have particular forms of anaphylaxis, which is a severe allergy to some of the vaccine constituents that actually need AstraZeneca instead of Pfizer. So it's not about winding it down because it's a bad vaccine. It's just the way the rollout is occurring. And this has been known for a long time.
Today we've seen the highest number of doses, in fact. So while there's been a bit of confusion, 161,390 is the number in the last 24 hours. So it hasn't prevented still the increase. I think the outbreak in some ways, Dr. Price, correct me if I'm wrong, but it's served as a bit of a wake-up call to many Australians as well. We might have fallen into a bit of complacency given how well we're done, but these outbreaks, at least there's one silver lining, that it's got people to go and get the jab.
I think you're absolutely right, Kieran. I think people can see more visibly what the risk-benefit ratio is when there's an outbreak. But the issue is that we have done very well. The public health instrumentalities have done very well in protecting us. We're an island nation. We've done pretty well. So that means it's been hard to see where this the viral enemy is. When there's an outbreak, you can more clearly see it. And I'm thrilled that people are coming forward and getting vaccinated. That's exactly what we need. That's how we're going to come through it. So, the guidelines are there to guide people. You want to operate outside those guidelines, go and talk to your GP. But vaccination plus all the other directions are important. And the other thing that's really important is that we operate together as an entire community, as an entire nation, not tearing each other apart about what happened where and who said what. We have to, this is a health crisis. We need to operate together with strong, clear messages. We need to operate together regardless of politics. We need to operate together based on the guidelines. And if we can do that, we will all get through. We can't leave anyone behind in Australia and really around the rest of the world too. So there's also, undeveloped nations who need to be having their vaccines too. So this is a whole world response. It's an extraordinary historical moment, and we just got to pull together, focus on what we're doing, and go through it very calmly, but with good reason at a reasonable pace, as fast as the supply will allow us.
Sure. No, well, I very much appreciate the clarity with which you've given your advice today. And just finally, before you go, let me ask you, what would you say to someone under the age of 40 if they came to your practice and said, I want to get the AstraZeneca jab? Do you give them the vaccine or not?
Well, I knew you were going to ask me that question, funnily enough. So, and I've actually had that conversation, funnily enough. So it's not a black and white answer. That's something that each individual has to come to. This is a shared decision-making process between the doctor and the patient, depending on each person's appreciation of risk and comfort. So that is something that has to be decided in a doctor's consulting room between two people who are informed enough to provide the education and the consent process should they wish to proceed. So it's not will I or wouldn't I? It would be like everything in medicine, it depends, and it depends upon the person and the doctor in that particular frame.